Hello dear viewers, today in this video I am going to discuss a very important topic, stress index on ventilator. So anyone or everyone who keeps on ventilating ARDS patient might benefit from this discussion. I am Dr. Sunil Garg from Essentials of Acute Care. So what is stress index and how it is useful? It is useful in ventilating ARDS patient. Stress index is a tool that measures the stress and strain imposed on the respiratory system during mechanical ventilation. So it provides a non-invasive approach to detect injurious ventilation and to personalize ventilator settings. It is derived from the pressure time waveform. A straight line is indicative of less injurious ventilation, and it has been shown to be a useful tool in predicting the risk of ventilator-induced lung injury and guiding PEEP titration in critically ill patients. There are two ways to measure it, qualitatively and quantitatively. Patient is kept on volume cycle mode of ventilation and ventilator flow is set at a square wave since flow must be constant. When flow is constant, volume and time becomes linear analogues. In other words, flow must be constant so that deformation of the pressure time curve reflect alteration in the elastic properties of the lung rather than demonstrating change in flow. There should not be any spontaneous breathing during tidal breath. During tidal breath, terminal portion of the pressure time curve is observed whether it is linear or with upward concavity or downward concavity. The curvature away from the pressure axis means y-axis. It means a stress index is less than 1 or tidal recruitment is taking place. If curve bends towards the pressure axis on the ventilator means tidal over distension and stress index is more than 1. Here is a pressure time waveform on a constant flow. Pressure is on the y-axis and time is on s-axis. In the terminal portion of the inspiration, you can see three different lines. Middle one is following the linear pattern means if we follow it down towards the beginning of the inspiration, it will join it without any curvature. The line below the linear line is away from the y-axis. This is y-axis and this line is away from the y-axis. At it indicates stress index less than 1 and recruitment is ongoing, while the line above the linear line which are bending towards the y-axis denotes stress index more than 1 and a reflection of overstretching. Regarding quantitative measurements, there are dedicated instruments which analyze the shape of pressure time curve or a specific ventilator which has a software algorithm to measure it. If we compare qualitative versus quantitative measurement, one study concludes that visual inspection of the pressure time curve means qualitative one on the ventilator screen is a simple and reliable approach to assess stress index at the bedside compared to quantitative measurement. And this simplification may facilitate the implementation of stress index in clinical practice to personalize mechanical ventilation. Here you can see three different graphs on a constant flow. Graph A is bending away from the y-axis and it indicates ongoing recruitment and stress index less than 1. In graph B, stress index is approximately 1 as the slope is linear which indicate stable alveolar inflation, and in graph C, stress index is more than 1, the slope is bending towards the y-axis which indicates alveolar overdistension. So to summarize, stress index provides a non-invasive approach to detect injurious ventilation pattern and to personalize ventilator settings. It is a useful tool in predicting the risk of ventilator-induced lung injury and guiding PEEP titration in critically ill patients. Stress index should be kept at or near 1 in mechanically ventilated patients. Here I finish. Thanks for watching this video. If you have any feedback, suggestions or comments, please write down in comment section. Please do not forget to subscribe to this channel. See you in my next video, how I ventilate ARDS patients. Till then, bye and take care.